A man in Atlanta thought he was scam-proof until a simple text about remote work turned into a costly lesson. 11Alive's consumer investigative reporter Liza Lucas explains how so-called task scams work and why investigators say they are becoming harder to spot.
I've never been scammed in my life that I know of.
Until October. That's when Bob Glazier says he responded to a text offering what seemed like easy work.
2 days of training, you get paid. I don't have to give them any financial information, no social security number. So I said, let's try it and go.
What Bob fell into is known as a task scam. Scammers start with text and promises of work like app optimization or product boosting. And at first, small payouts build trust. Then the stakes go up and victims are asked to put up their own money to keep it going. 11Alive has covered these scams before. Last July, we shared another warning from a local woman who said she lost around $30,000 to a similar scheme.
These are professional syndicate criminals in a lot of instances. They understand you, they look at your social media, they've profiled you, and they understand what to say and what to do.
FBI Atlanta told 11Alive at the time the growth of remote work combined with social media and AI is making these scams harder to spot. And it's not just job seekers affected. 11Alive spoke with the leader of the legitimate company impersonated in Bob's case. They say they filed multiple takedown requests for the fake website. As for Bob,
if I'm not going to get anything back, I'm going to make sure other people don't get scammed the same way.
Liza Lucas, 11Alive News.
So to make sure that you avoid having to go through that and those scams, the FTC says there are red flags you should really watch for. Ignore generic and unexpected texts, WhatsApp messages, or even Telegram messages about jobs. Real employers will not contact you that way, so never pay attention to anyone. Never pay anyone to get paid or to get a job. That's a sure sign of a scam. And don't trust anybody who says they'll pay you to give a positive rating or like things online. No honest company is going to do that. Georgia-based company Susanna's Kitchen is recalling its ready-to-eat grilled chicken breasts for possible listeria contamination. So if you have them with these labels right here in your fridge, the USDA says throw them out right away. Nobody has been reported sick, but they want to make sure that nobody does get sick. So new at midday, the price of gold and silver has now reached new highs. Gold rose to a little more than $4,600 per ounce on Monday, with silver right behind it with just over $93 per ounce. Gold and silver tend to perform well in periods of heightened uncertainty. The surge comes after President Trump threatened the new tariffs on European countries as he's pressing for a deal for the U.S. to take control of Denmark's territory of Greenland. More than half a dozen major medical groups are suing to reverse recent changes to the CDC's childhood vaccine guidelines. The groups, including the American Academy of Pediatrics, say the new recommendations are risky and should be reversed. The updated guidance limits some vaccines to only higher risk kids. We have an update for you on flu cases in the United States. The latest CDC data showing that while flu cases remain elevated across the country, the amount of activity has decreased, stayed stable at least for 2 consecutive weeks. But here's a disturbing number they are highlighting. We're seeing an upward trend in the number of people dying linked to the flu. Mandy Gaither talked to a pediatrician about why children are one of the groups at highest risk of catching the virus and how to best protect them.
In the U.S., hospitalizations for flu in children younger than age 18 have the highest peak weekly rate in more than 15 years. And in the latest week of data, there were 15 flu-related pediatric deaths for a total of 32 reported child deaths associated with flu this season. The CDC says 90% of those who died were not fully vaccinated against flu.
Children, especially under the age of 2, they're pretty small. And when they're still small, you get something that's just so inflammatory, like influenza. When it gets into your lungs, it causes a lot of inflammation.
Dr. Frank Esper with Cleveland Clinic Children says the best protection against severe disease is for adults and children 6 months and older to get a flu shot.
By protecting yourself against influenza, you're also protecting everybody in your family.
Washing hands and highly touched surfaces can also help prevent the spread. For young children, especially at preschool, Esper recommends an adult using an alcohol-based rub to remove germs.
Alcohol is actually a better way to clean off their hands than to use soap and water.
If a child is sick, Esper says to keep them home, and you can also consider masking.
We masked up during the first rounds of COVID. We saw flu just drop because everybody was staying away from each other. Everybody was masking when they were out, and flu couldn't get through that.
For Health Minute, I'm Mandy Gaither.
This midday, President Donald Trump continues to push for Greenland to become a U.S. territory. Here's what he said about it as he left the college football national championship game in Miami.
I don't think they're going to push back too much. Look, we have to have it. They have to have this done. They can't protect it. Denmark, they're wonderful people. And I know the leaders are very good people, but they don't even go there.
President Trump argues the territory is vital for U.S. security and threatening a 10% tariff on 8 European countries that oppose his fight. Upping that 10% to 25% is his threat. Happening tomorrow, the Supreme Court will hear arguments about President Trump's attempt to fire Federal Reserve Governor Lisa Cook. The justices allowed her to stay on the job while the case is reviewed. Federal Reserve Chair Jerome Powell will also attend. This comes as he wages a broader battle to preserve the Fed's independence, and Cook is from Metro Atlanta. The Trump administration's move to suspend immigrant visa processing for 75 countries that could impact the World Cup travelers. Maria Guerrero has more.
This is only for the people who are outside the United States.
The State Department calling it a visa freeze, suspending immigrant visa processing from 75 countries beginning Wednesday.
We're talking about people who have been in the line.
Immigration attorney Jaime Vasquez unsure of the administration's reasoning for the pause, accusing legal migrants from these select countries of abusing the American welfare system once here.
When somebody's a resident, they have to have a financial sponsor. And even if they were going to use public benefits that they do not qualify, the government can go after that sponsor.
Who is not affected by the suspension?
Yeah, so the suspension only applies for immigrant visas.
The crackdown coming as the State Department shares another cordial invite to the world.
America is excited to welcome the world to the 2026 World Cup.
The leader of the White House task force on the World Cup taking to X on Sunday, reiterating what he said last month during a tour of AT&T Stadium. The suspension does not apply to short-term tourist visas.
So it has no effect on B1, B2 visas, which is what the fans will be coming here on. If anything, actually, it'll probably reduce some of the wait times for them.
With the largest FIFA footprint, North Texas will host 9 matches, including reigning champ Argentina. Andrew Giuliani saying World Cup ticket holders will have their travel visa applications prioritized. Wait times for Argentinians and Brazilians, for example, are being significantly reduced from 1 year to 2 months or less. And it's worth noting soccer fans living in the 75 countries on the immigrant visa suspension list can still apply to visit the U.S.
Now, tourist visas are not granted freely, and they will have to be evaluated, and the government will determine whether or not the person has the intent to come back to their country in the process of granting that permit.
We're going to see those temperatures warm up into the 40s today for everyone. Even up here to the far north, we'll be in the low 40s, mid 40s for us. Slightly cooler than we were just yesterday. If you were out and about, you know how cold it was. Despite the fact that we had all that sunshine around, it was a cold afternoon. It's going to be a cold afternoon today as well. Clouds over us extend all the way back into Texas, but there is no precipitation coming out of those clouds at all. We don't have to worry about that. But we will see the winds about 10 miles per hour or less for today. High pressure is taking control, and so we have that northerly flow coming in, front pushing a little bit further down to the south, getting out of the way. The same area of high pressure will start to slide east, and we'll get back into a southerly flow, which will help to boost those temperatures up starting tomorrow afternoon. It'll be another cold start for you Wednesday. We'll be dry for much of the day. It won't be until after the sun sets that we'll see some isolated showers begin to pop up in our area. 30% chance for scattered showers on Thursday. Friday the same, and then it goes up a little bit as we head into the weekend, and that's where that cold air comes in. And so that's what we're watching for. That's what we're going to see if things begin to play out. Here's how it plays out. Forecast track model shows Nothing but sunshine for today. We're looking good. Tomorrow, we'll start off with a little easterly flow coming in and then more southerly once we get into the afternoon. Clouds will be arriving by the afternoon as well. After the sun sets is when that precipitation will start to make its way down toward the metro area. Here we are by 9 o'clock. Becomes isolated. May start off as scattered, but becomes isolated. We'll continue to see those scattered showers in the forecast as we head through the day on Thursday. I think by Thursday afternoon, things will begin to settle down as far as the rain goes, but we'll hold on to the cloud cover. And the same as we head into Friday, we'll be looking at the chance for some showers to be around. Once that cold air arrives, as we head into the weekend with the moisture around, we're looking at the potential for, again, freezing rain, could be snow. Still a lot of uncertainty this far out, so we'll pinpoint that for you as we get a little bit closer as to who will receive what, how the temperatures will be, the type of precipitation, all that. We'll give it to you, folks. Temperatures will be cold over the weekend and into the beginning of next week where things will begin to subside.
As Congress continues to debate the future of America's healthcare system, patients are starting to see costs go up. The Affordable Care Act subsidies are now expired, and the so-called One Big Beautiful Bill Act made heavy cuts to Medicaid. 11Alive's Joe Ripley explains how these changes are impacting people here in Metro Atlanta.
Dr. Robert Contino runs Ethne Health, a clinic that largely serves immigrants and refugees in DeKalb County. He's kicking off 2026 concerned.
In Georgia, it's estimated that 750,000 people are going to lose their insurance. And I'm almost certain that the large majority of people that lose their insurance are going to be from lower income communities just like ours.
Contino says many of his patients, some of the most vulnerable, are going to be hit hardest by cuts to Medicaid and the removal of Affordable Care Act subsidies. In July, President Trump signed the One Big Beautiful Bill Act into law, which includes substantial cuts to funding for Medicaid and Medicare. In October, the government shut down over whether to extend the ACA subsidies, driving up insurance premiums this year.
We have to realize that health doesn't happen in a vacuum. We need the social services, we need the healthcare system to work together, and seeing our patients not just as a number, but as our neighbors.
Contino's colleague, Dr. Esther Kim, is an immigrant herself. She says lawmakers should reconsider policies that increase access and affordability to care. Chris Denson with the conservative-leaning Georgia Public Policy Foundation says the federal government must rein in spending and cut waste. He says he does not expect Medicaid cuts to impact Georgians as much because the state did not expand Medicaid and does not pay as much as other states in provider fees.
Insurers are attributing the cost of the rise in health insurance premiums to structural pressures like higher medical utilization, inflation, hospital consolidation.
Dr. Contino says Congress needs to act fast because so much is on the line.
It can be devastating. It can be really a matter of life and death.
Joe Ripley, 11Alive News.
There is a new push from the White House to adopt direct payments for those on government health care marketplace. Many congressional Republicans are opposed to spending more on the Affordable Care Act subsidies. Earlier this month, Congressman Buddy Carter voted no to extending the ACA subsidies, saying patients deserve better than a system designed to serve big insurance and illegal immigrants.